Every morning since the ambulance came for her husband begins just like this for Martha Farnell.
I always leave here between 7:30 and of course so I'd be there in time to give him breakfast.
For 66 years, they've been together, beginning with a life in the military and eventually settling in Calgary, always together. But at 89, dementia and then a fall have pushed Willard first into hospital and now a long-term care facility. Martha is with him as often as she can be, even when he's napping. She can still live independently, doesn't need the level of help he does. And that means it's much harder to stay together in a system just not designed for couples. You want to be together?
Yes, that's the way I feel, yes.
That's what you want?
That's what I want.
Is that being offered to you?
No, that is not offered to me because they say there's nothing wrong with me.
What do you worry about?
He's just going to deteriorate so fast without me. He will, because he just depends on me for everything.
Martha's story is one you may have heard before.
Oh, thank you.
Across Canada, couples are routinely separated when one needs more help.
As long as I've heard it.
Reuniting them under one roof can take months, even years, if it happens at all. In Sweden, separation is almost unheard of. The system there built to recognize the value of keeping loved ones together. In fact, couples there have the right to live together. What would it mean for you at this stage in your life to not be together?
Jag skulle inte känna mig lugn om jag var hemma och Torsten var här på samma sätt som. Och jag tror det skulle betyda ännu mer för Torsten att vi får vara tillsammans.
After decades together, Nancy and Torsten can't imagine life apart. A debilitating stroke may have robbed him of mobility and speech, but he hasn't lost her.
Får ni vänta länge?
He cannot live independently, but in Sweden the system is set up so he doesn't have to face old age alone.
Efter att Torsten fick sin stroke så bodde han hemma, så vårdade vi honom hemma i cirka 8 månader. Och det hade jag fortsatt med om jag inte hade fått detta erbjudandet. Att vi hade möjlighet att bo tillsammans. För vi får ju bättre hjälp här än hemma. Hjälpen finns på andra sidan dörren när vi behöver det. Och det ger en stor trygghet.
It would be too much for her to handle alone at home. But here at a care home where both can live, help is never far away when it's needed.
Jag talar om för personalen att jag är borta mellan klockan så och så. Och de tar hand om Torsten under tiden. Ska han lägga sig och vila så kommer de. Och ska han upp så kommer de också på fasta tider. Det går väldigt bra.
They aren't the only exception in Sweden. This is the rule. Couples stay together, not just until one can no longer care for the other, but until the end. Hello.
Hello, hello.
Hey.
Hey.
Ruth. David.
Hey, Ruth.
Ruth, good to meet you. Ruth and her husband of 6 decades lived here. Now, though, she's in mourning.
It's only one bed now. Her husband passed away last week.
I'm sorry to hear that.
So now she feels it's a little bit big for her, the apartment. It's hard now.
Hard now, certainly. But imagine how much harder had Ruth and Horner been separated. In Canada, it would have been a near certainty. In Sweden, it would have been seen as a failure. For Sweden, this is as much about maintaining companionship as anything else. So these are brand new?
Yes.
Take these new apartments designed for 2. Nice. So who are these designed for?
It's for people so they can stay together longer.
Like a couple?
Yeah, a couple. Or if you have a best friend you want to stay with, or a child or something. There's a lot of lighting going on.
Driven forward in a partnership between IKEA and the country's queen, they are specifically designed to ease the symptoms of dementia.
It's a timer on the outlets. You can also install for the water, so you don't leave it running.
Andreas Melkerson is a nurse here.
Here, light switch.
Oh yeah, it's almost like a little night light, but it's on all the time, right? Blinds to avoid mirroring from the windows.
Yes. If you see yourself in the window, it can scare a person with dementia.
As people live longer, more with dementia, Sweden is rising to meet the challenge of this growing disease.
It's a lot of contrast here as well.
Without cutting people apart.
We want to do something new here.
And this is that new thing?
This is the new thing.
And with plans for more, a safe environment where being together is itself a form of care. Keeping lives together as one just seems like the right fit. What would you say to a country like Canada that don't have couples staying together in their later years of life?
Det kan inte bli bättre när man ändå är i en sån svår situation. Så är det bästa som kunde hända oss i alla fall. Den där kan du ta kanske.
The circumstances are ideal for Nancy in Sweden, but not currently an option for Martha in Canada.
This is all Canadian soldiers where we were picnicking.
Even as she flips through decades of memories, she's now focused on her future and asking health authorities why Canada and Sweden are so different.
And I said, why don't you start doing something in Canada? Why can't Canada change the system? A little bit behind. This is some of our gatherings that we always had in there.
And so she'll keep fighting to be with Willard, pushing for the rare rooms for two, a place to both care for her husband and live with him.
I want to be there with him and do stuff for him. And that's my main objective. And I've often said, I said when I knelt down before God and said, until death do us part, I meant that we've written each other letters, and that's what we both have in our letters, that this is what we want. We want to be together till the end.
Martha knows that may not be long for Willard. She's intent on keeping what she sees as a promise to him and to herself. David Coleman, CBC News, Calgary.